Good afternoon. Welcome everyone to the Senate Committee on Health and Human Services for the 83rd Legislative Session. Madam Secretary, please proceed to call the roll.
Senator Lang. Here. Senator Stone. Here. Senator Taylor. Present. Senator Titus. Here. Chair Doniate.
And I'm here, and everyone's present. Good afternoon, everyone, and thank you so much for joining us. Today we do have two bill hearings on Senate Bill 138 and Senate Bill 207. We are going to be going in that order, and so just a few housekeeping items for individuals that are joining us from here in Carson City and in Las Vegas. If you wish to testify, we ask for folks to please sign in at the table by the door and provide a business card to the committee secretary. And for folks that would not want to testify, we still ask for you to sign in at the door so that there's a record of who is interested in a particular bill. If you choose to testify for today, we ask that you please turn the microphones on to speak and off to listen. And we have listeners and viewers in Las Vegas and online, and are recording this meeting as it will be available on the legislature's website later. For those that are interested not on the bills but just in public comment, we do have a public comment section at the end reserved for the meeting, and then we also ask that any comments today be kept to 2 minutes so that everyone interested in speaking can be accommodated and we can get through the agenda in a timely fashion. Speakers are urged to avoid repetition on comments made by previous speakers, and then lastly, we do ask for folks to please silence their electronic devices. With that, we're going to go ahead and start with Senate Bill 138, so I'll go ahead and open the hearing on this bill. This bill makes revisions governing Medicaid eligibility and enrollment for certain infants, and we're proud to welcome our Majority Leader, Senator Cannizzaro. So please begin when you're ready.
Thank you, Chair Doniate and members of the Senate Health and Human Services Committee. For the record, my name is Nicole Cannizzaro. I proudly represent Senate District 6 and serve as your Majority Leader here in the Nevada State Senate. I am very proud today to be here to present to you Senate Bill 138 for your consideration, alongside my co-presenters, Jennifer Atlas and her son, Bo. To begin, Mr. Chair, I would like to bring the committee's attention to what is a proposed conceptual amendment for Senate Bill 138. This conceptual amendment does show the new language that will be coming for this particular bill, and the bill now focuses on ensuring that hospitals providing birthing services are enrolled with Medicaid as a provider of presumptive eligibility services, and ensuring that they are screening pregnant women who may be eligible. The amendment also enshrines the rights of parents with children in the NICU, the right to know, the right to be involved, and the right to be set up to succeed as a parent leaving the hospital for the very first time. To talk just very briefly about Senate Bill 138, I would like to note that this bill seeks to strengthen healthcare access for pregnant individuals and newborns in Nevada by ensuring that all hospitals providing birthing services enroll with Medicaid as a provider of presumptive eligibility services. Under federal law, hospitals have the option to screen patients for presumptive eligibility for Medicaid. However, not all hospitals currently participate in this process. By requiring participation as a condition of licensure, we ensure that all eligible pregnant patients receive timely health care coverage, reducing barriers to essential maternal and infant care. Under this amendment, hospitals will be required to have qualified hospital staff screen all pregnant patients for presumptive eligibility coverage in accordance with 42 CFR 435.110A. If a patient is determined to be eligible, they will receive written notification outlining their benefits, the coverage period, and instructions for applying for full Medicaid benefits in Nevada. If a patient is determined ineligible, they will receive a written notice explaining the denial and guidance on submitting a full Medicaid application. Additionally, this amendment includes provisions to support families of newborns with special medical needs. If a newborn is born prematurely, with low birth weight, or with any condition qualifying them for Supplemental Security Income, or SSI, hospital staff must provide written notice to the parents or caregivers that the newborn may be eligible for SSI, and by extension, Medicaid presumptive eligibility coverage. Finally, this amendment establishes a NICU Parents' Bill of Rights to provide critical protections and assurances for families who are navigating neonatal intensive care. This Bill of Rights affirms that parents have the right to receive clear, timely medical updates, to be involved in decision-making, to provide things like skin-to-skin contact, to access breastfeeding support, and to receive mental health resources, among other important protections. By enshrining these rights, we promote transparency, family-centered care, and improved health outcomes for vulnerable infants. With that, I do want to note that there are some very real reasons why this bill is coming before you today. This bill is designed to ensure that babies and parents are receiving adequate health care within our healthcare systems, especially when those babies become part of our little team that ends up in the NICU. I have some very important presenters with me, Mr. Chair, that I am going to pass the presentation over to in just a moment. But I do want to make just a couple of remarks before doing so. There was a fiscal note on the original language of this bill, and while this is not a money committee, I think it's an important thing that we've been trying to figure out how to navigate. That language and that fiscal note from the Division of Welfare and Supportive Services of the Department of Health and Human Services should now be removed once an amendment is adopted. And again, we are talking about the conceptual amendment that has been provided to the committee and has been posted for everyone else to view as well. I want to thank you for taking the time to hear Senate Bill 138 and granting me the latitude to go first today. Ensuring that equitable access to health care is available for all pregnant individuals and newborns is a critical step in improving our maternal and infant health outcomes in Nevada. I definitely urge your support for this amendment and this bill as amended. We'll be happy to answer any questions that you or the committee may have, but first I would like the time to turn it over to Jennifer Atlas to talk a little bit about why it is that this bill is such a critical and such an important need for so many Nevada families.
Thank you, Majority Leader, Chair Doniate, and members of the Senate Health and Human Services Committee. My name is Jennifer Atlas, Jenniferatlas, and as most of you are aware, I currently work for the American Cancer Society Cancer Action Network, but today I sit before you as a mother who was granted a miracle. My son Beau was born after 56 hours of labor through an emergency C-section. I barely remember his birth. I was septic and struggling to stay awake, but I remember the silence. There was no cry from my baby. In that instant, Beau was taken away to the neonatal intensive care unit, the NICU, and the world as I know it turned into a living nightmare. The NICU is a place of paradox, a sanctuary where fragile lives are saved, but also a battleground where parents stand powerless and unarmed. There I watched my son, his tiny body entwined with tubes, surrounded by machines, the rhythmic beeping a haunting reminder of how fragile his existence was. For 5 agonizing days, Beau lay in an induced coma, suspended between hope and uncertainty. After 20 days in the NICU, we finally brought Beau home, but not without a constant reminder of how fragile he still was. He came home on oxygen, a constant reminder of a tether to the battle he had fought so early on in life. It's both inconceivable and heroic that so many families endure this journey even longer. As we crossed the threshold back home, leaving the uncertainty of the NICU behind us, what came next was nearly as cruel. A hospital bill so staggering it seemed beyond comprehension, totaling nearly $500,000. While our insurance covered the majority, we were still left with overwhelming out-of-pocket costs that only grew as Beau required ongoing medical care in his early years. During those exhausting days in the hospital, I was handed a Medicaid application. Overwhelmed and emotionally drained, and naive to the complexities of the system, I pushed it aside, assuming we wouldn't qualify. I didn't understand that Beau qualified for Medicaid because of the circumstances of his birth. I had insurance through my employer and assumed we wouldn't be eligible because expenses would be covered, but I was wrong. I remember holding Beau in my arms, finally home, while on the phone with the insurance company, desperately trying to prove that he was sick enough to deserve coverage, as if surviving a stroke, spending weeks in the NICU, and coming home tethered to oxygen weren't proof enough. I had survived. My baby had survived, but my financial stability was destroyed. I share this with you because I know my story is not unique. You'll hear from parents today whose babies fought for their lives while medical bills stacked higher than they could ever afford. They sat in NICU rooms just like I did, helpless, terrified, and then were handed a stack of paperwork alongside with their grief. Some were forced into debt they'll never escape, and some lost their babies and still had to pay the bill. Right now in Nevada, when a baby is born into crisis, when they're taken from their mother's arms and rushed to the NICU, their parents are expected to navigate an insurance system that wasn't designed for them. Paperwork, approvals, and delays, all while their child is fighting for life. One missed signature, one processing error, and one bureaucratic delay could mean a lapse in coverage when it's needed the most. SB 138 does something so simple and so obvious that it should have been done already. It automatically enrolls NICU babies in Medicaid if they already qualify. This bill is not expanding the universe of children who qualify, but rather a promise that no family will be left to navigate a financial crisis while their baby is fighting to live. It's a fiscally responsible approach that ensures hospitals and providers receive payment while preventing families from falling into medical bankruptcy. I was granted a miracle. My NICU warrior, Bo, is here today, 10 years old, strong, smart, and full of life, because of the doctors and nurses who fought for him, because of modern medicine, because in the end, sheer stubborn luck was on our side. That miracle will always outweigh the burden of medical bills, but no family should have to carry that weight in the first place. There is no reason to allow others to endure such unnecessary hardship when we have the power to change it. I'm asking you to pass this bill for the parents who at this very moment are sitting beside an incubator, watching over their fragile newborn, praying that their NICU warrior will survive. Pass it for the infants who cannot speak for themselves, whose futures depend on the care that they receive today. Pass it so that no family in Nevada has to endure the fear and financial devastation that mine did. This is our chance to ensure that when a child's life hangs in the balance, their family's financial stability does not have to. Thank you. And now I'll let my son Bo speak.
Hi, my name is Bo Tucker, Beautucker, for the record. When I was born, I was very sick and had to stay in the NICU. My mom had health insurance, but she was still left with huge medical bills. That's not fair. Parents should be able to focus on their baby's health, not on fighting through paperwork or worrying about costs. My mom calls this Bo's bill babies enrolled automatically. Bo's bill will make sure all NICU babies are automatically covered by Medicaid so families can focus on their baby's health instead of worrying about paying. I hope you'll support it. Thank you.
Mr. Chair, Nicole Canizaro, Senate District 6. I think that this is just one story out of countless others, some who may share today and so many others who are not sharing. For babies who are born in precarious situations. There are families who are praying and hoping that their baby is going to come home. And I should have started this, and I have to apologize because I should have started this hearing with noting that this bill is what we are calling Bo's bill. I think that it is important to hear why this is important from real people who this has affected. This bill is not seeking, just so that we are clear, to add folks to the Medicaid rolls who are not already eligible. It is not seeking to have undue burdens put on families or anyone else. This is saying that if you are going to be in a hospital giving birth to a baby, you are a birthing hospital, that you need to provide the ability for these families to know, because they just don't know, that they will qualify for coverage so their focus can be on their baby and not on whether or not they are going to be able to financially sustain the impact from all of this medical intervention. It is scary enough to be someone who is having a baby. It is even more frightening beyond my comprehension to be in the position of Jennifer or certainly baby Bo. What we are asking for here is so that people know that they can qualify for this coverage so they can focus on their babies. Mr. Chair, we would be happy to take any questions that you or the committee members may have. Thank you.
Thank you so much. Committee members, any questions? Senator Titus.
Thank you, Mr. Chair, and first and foremost, thank you for being here and sharing your story. And Mr. Tucker, you're looking very good there, and I just would request of you that in 6 years you come back and be my intern. But I have a question, Majority Leader, please. I certainly support the bill in concept, but I have concerns about the amendment. And so addressing the amendment in the first paragraph on the proposed amendment, as a condition of licensure, hospitals operating in the state that provide birthing services must enroll with Medicaid as a provider of presumptive eligibility. So is this saying that existing birthing centers, existing hospitals that already deliver and possibly have NICUs are going to lose their licensure if they do not do this?
Thank you for the question. Nicole Cannizzaro, Senate District 6, through you, Mr. Chair, to Senator Titus. Senator Titus, we are not intending to remove or revoke licensure from hospitals. I'd be happy to work on any language that might be appropriate to ensure that any currently licensed birthing hospitals are able to enroll as such and able to provide this information to their patients. But certainly the bill is not a backdoor way to remove licensure from a hospital that is currently licensed. What we are trying to do, though, is say that as part of having that license, right, because that's where we can tie it to, that's where the state has some sort of oversight and ability to have a say-so in that, is that hospitals have to enroll as a presumptive provider, which they will qualify as, and that they have to provide this information to their patients who would qualify. Obviously, if there's a patient that does not qualify, just to be clear, this does not somehow automatically entitle them or enroll them or entitle them to some sort of eligibility, right? And so if there's language that we need around that first paragraph to ensure that this would give hospitals the requisite amount of time to complete all of those steps and become an enrolled provider and to put into place the things that they would need in order to make sure that they're giving these families this information, we'd be happy to talk about that and do that. But that's not the intent.
All right, and thank you, because I just want to make sure that if a hospital chooses not to enroll in Medicaid, they would not lose their ability to be in this state, because Medicaid has pros and cons, and certainly we have many babies on Medicaid, and certainly we need that backstop for cost. However, again, knowing what Medicaid does not cover, mandating that they enroll in Medicaid has me concerned.
Thank you for that question, comment, Senator Titus, through you, Mr. Chair, to Senator Titus. Nicole Cannizzaro, Senate District 6. What we are asking is for that these hospitals that provide birthing services would need to at some point become an enrollee to provide these services, because otherwise, where you have babies that are going to be placed into the NICU there, they should be aware that they would qualify for this coverage. Again, if there are logistical questions or concerns about how that would take place, we can work that out, I think, in the bill language and are certainly amenable to doing so. The purpose of passing this bill is not so that suddenly the day after this bill goes into effect, a bunch of hospitals are unlicensed. We can certainly provide runway to do that.
Thank you, Mr. Chair.
Thank you, Senator Stone.
Thank you, Mr. Chairman, and Madam Majority Leader. Thank you for bringing the bill forward. I had the pleasure of meeting Ms. Atlas and Bo in my office and heard of this frightening story. Ms. Atlas, when you were in the hospital, obviously you were concerned about your child in the NICU unit. They shoved this piece of paper at you and said, you want to sign here for Medicaid. You thought that you had appropriate insurance, that I know I don't need state aid. I've got private insurance. It's all going to be taken care of. And then tell us more about your story about how you found out that you had these horrific bills.
Thank you, Senator Stone. Jennifer Atlas, for the record, through your chair to the senator. This is something that I honestly didn't know could have been an option for me, that Bo should have been enrolled in SSI and Medicaid until he was probably 7 or 8 years old. I didn't have the knowledge that I do now. I was a professional ballroom dancer. I worked in hospitality. I didn't know that there were people I could go to, that I had representation in my state legislature, that I could say, like, I don't know why I'm getting these costs. So, through coming through this career path and learning about advocacy, I did realize that if I had just filled out that paperwork, the bills might not have come quite as large, and that my son could have been covered.
If I can follow up.
And Mr. Chair, if I may,
Thanks.
Senator, Nicole Cannizzaro, Senate District 6, through you, Mr. Chair, to Senator Stone. I think one of the things that you are getting at is trying to be addressed in this bill, right? Which is making sure that families and people who are in a position where they're going to be having a baby have that information, right? That they're getting that information ahead of time, that there are these benefits explained to them. Because one of, I think, the issues that exist for a lot of these families is they don't know, right? Ms. Atlas did not know that her baby would have qualified. There wasn't anything there to have somebody come to her and say, listen, you're about to have a baby. Let's say something goes wrong. And when you go in to have a baby, by the way, there's a ton of things that they go over with you, right? Do you want to have an epidural? Do you want to have skin-to-skin contact when your baby is born? Are you planning to breastfeed or bottle feed? You have to consent and sign off on all of these things before you actually have the baby for folks who are going in and registering. And obviously, there are situations where people are showing up and having a baby at a hospital, but like a lot of these things, all these different touch points are discussed with those individuals. This should be one of them, right? If something goes wrong, if your baby qualifies for SSI, if you fall under this eligibility for Medicaid, can we go ahead and get that process going? Or once you have a child and your baby is in the NICU, that there's somebody who's there to explain all of this to you. That's part of what this bill is also seeking to address.
Thank you. I appreciate that. It would seem to me that if you have private insurance and your child qualifies under SSI to get Medicaid, I'm looking forward to hearing from the hospitals as to why they wouldn't embrace the program. I mean, would they rather have uncompensated care, or they rather have reimbursement? And this would certainly require the HHS director to administer changes in the existing state plan should this get passed, correct?
Thank you for the question, Senator Stone. Through you, Mr. Chair, to Senator Stone, Nicole Cannizzaro, Senate District 6. So I'm glad that you actually brought up the point about uncompensated care, right? Because what we're talking about is a family who, even if they have other insurance, that baby qualifies for this Medicaid coverage to be in the NICU. So they don't have to have that bill at the end, right? But the problem with this is that then you have a baby who is in the NICU, who is not being covered by that private insurance. That is uncompensated care in as much as it pertains to the hospitals. I have, for a long time, been an advocate of if we can find ways to have less uncompensated care, right? Care that might be paid for through Medicaid, we should be doing that. I do not believe, and I do think that there are others who can answer this question better than I can, but I don't think that this will require there to be too much of a change with respect to the state plan. Our hospitals, and I should have noted this ahead of time, hospitals here in Nevada are already enrolled with Medicaid, right? Medicaid currently covers a number of births here in the state, about 1 in 2. It's a significant number of births here in the state that are covered under Medicaid already. And so I think where we can find these pieces where there is less uncompensated care, that should certainly be something. And where a lot of these hospitals are providing NICU services, right? Because we talk about this a lot in our finance committees and have in previous sessions with respect to increasing reimbursement rates for hospitals who provide NICU services. That is something that we would want to make sure, right, is being covered so they can continue to provide those services. And I think that this is certainly one piece of that. And with respect to the more technical questions on the state plan for Medicaid, I certainly would leave that to either our very competent and able LCB staff, or certainly to our Department of Health and Human Services. And I think we may have someone in the audience, and I don't know if she can answer that question or is willing to answer that question. But if she isn't, I will certainly get that information and give it to you in the committee.
Thank you.
If you ask, she will appear.
I don't have to. It's the question whether or not we will do a state plan.
Yeah, whether or not you have to have an amendment to the state plan.
Stacy Weeks for the record. Right now, we currently do presumptive eligibility, so we shouldn't have to do a state plan amendment. This is really just making sure that hospitals are participating in helping pregnant women access Medicaid when they need to for their infants.
Yes. So, Ms. Weeks, if a hospital takes Medicaid presently and they haven't done this presumptive eligibility before, are they able to bill after when they find out that somebody doesn't have insurance or they've got high medical bills as a result of a NICU incident?
Stacy Weeks for the record. Nevada Medicaid, no. The only way they can do that is through presumptive eligibility. We can backdate to their, so what it is an abbreviated application that the individual would fill out and sign. They are presumed eligible, and so anything that occurs during that time is covered by Medicaid. They do have to fill out the full application within, I think it's 60 days. And at that point, they may not be determined eligible for Medicaid beyond that, but those services during that time, they are presumed eligible and covered. Yep.
Thank you. It just makes a lot of sense. Thank you, Majority Leader, for bringing this forward.
Any other questions? Vice Chair Taylor.
Thank you, Mr. Chair, and thank you, Madam Majority Leader, for bringing such an important bill. And Ms. Atlas and Bo, you'll be sitting in this seat in just a few short years from now. I'm just keeping it warm for you. My question is, let's say if there's a hospital that doesn't share this information with the mother, and so then therefore the $500,000 worth of debt shows up. Is there an appeals process? What if the mother was not aware? What is there any backstop for them?
Thank you for the question, Madam Vice Chair. Through you, Mr. Chair, to Vice Chair Taylor, Nicole Canizaro, Senate District 6. The language of the bill does not contemplate an appeals process for that. Obviously, the mechanism for enforcement for this, right, is tied to hospital licensure to make sure that they are enrolled and that they're providing this sort of information, but certainly can provide any other guardrails that might be appropriate. I think the tough part for the families, right, if a hospital is not doing this, and that's why it's tied to that, is, and I think that Ms. Weeks sort of spoke to that, right? If you are not enrolled in this program, you can't come back and backdate it, right? And so that's why we want to make sure that this information, to the extent is possible, before someone is showing up in the hospital and having that baby, that they're filling out this information and they're aware, right, that their baby, if that baby does then find its way into the NICU, right, that they could be deemed presumptively eligible, and then those services would be covered. But I think, unfortunately, if it does not happen, you leave a family with a significant amount of debt that they have to figure out how they would have to pay, and which is what we're trying to solve here. So hopefully we will have good actors who will come forward and implement this and follow the law and do what they're supposed to do, make sure we're getting that information, make sure that families are getting enrolled when it is appropriate, but certainly happy to discuss any language that would provide any guardrails that might make sense in that regard.
Thank you, Madam Majority Leader. Thank you, Chair.
Any other questions? I got one for Bo. Bo, what's your favorite ice cream? You gotta press the button.
Strawberry. Bo
No.
Tucker for the record.
There
Strawberry.
There you go. Well, thank you so much for your advocacy, and you did a wonderful job. We're going to go ahead and open it up for testimony and support. So for families that would like to go, or for folks and families that would like to testify and support, we ask for you to please come forward, both in Las Vegas and in Carson City. And we'll start here. So please begin when you're ready.
Good afternoon, Chair Donate and members of the committee. My name is Crissa Marco, CRISSA for the record. I also submitted a full letter as an exhibit. I'm here because of my son Bennett and the endless lessons he taught us in his 8 months of life. He was a feisty little man, and I'm trying to channel his spirit here today. I'm here in support of passing SB 138, so future parents of babies in the NICU can spend every available minute focused on the love and medical care of their baby, not on navigating a complex system to access benefits their baby qualifies for. SB 138 aims to eliminate barriers that currently result in NICU parents facing unnecessary medical debt, a challenge we personally experienced. Today, I want to share how every moment in the NICU matters and ask you to vote yes on SB 138. In 2020, I learned I was pregnant, a very welcome surprise. At our 20-week prenatal appointment, we learned Bennett was not receiving sufficient blood flow. At 22 weeks, I was admitted into Renown and had an emergency C-section at 24 weeks. Bennett was not even a pound, weighing 15.5 ounces, and was immediately intubated and admitted into the NICU. Little did we imagine the next 8 months, his entire life, would be encased within the walls of Renown NICU, UC Davis NICU, back to Renown PICU, and then the UC Davis PICU. The NICU was a unique, harrowing experience. I couldn't hold Bennett until he was almost 2 months old because he was so medically fragile. Alarms are constantly going off. You rely on your NICU nurse to explain the slightest changes with your baby. Why is his oxygen so low and his heart rate so high? Is he dying? No, he's just upset, or his lung collapsed, or he pulled out his vent tube, and they have to call in the respiratory therapist. And these are all things that happen to Bennett. You learn a medical dictionary of terminology, medications, diagnoses, how to read x-rays, the potential long-term effects, and just how precarious every moment is. I can't tell you how many times we heard Bennett was not going to make it through the hour, the day, or the night. Outside of the NICU, you try to keep some sort of normalcy for your family. So when the NICU social worker told me she was leaving us a packet for Medicaid, I wrote it off as unnecessary. I didn't think we would qualify based on our income and with my insurance coverage. I can't recall if the social worker explained Bennett qualified because of his birth weight, but Medicaid coverage shouldn't depend on the right person saying the right thing at the right time so that you hear it. In January 21, Bennett needed an emergency flight to UC Davis NICU to preserve his eyesight. I even asked if the flight was covered by my insurance, and I was assured it would be as it was medically necessary. However, we received a bill for over $70,000 after my insurance paid, as the air ambulance company was out of network. Having Medicaid to supplement my insurance would have covered the bill, but in the end, the Medicaid process was insurmountable despite the resources available to us. And we did try the backdating process and were unable to reach anybody to receive that backdated coverage. This is unacceptable. I implore you to make a common sense, compassionate, fiscally sound vote in support of SB 138 to improve a broken system that leaves families in unnecessary medical debt and robs them of time spent with their baby in the NICU. Thank you.
Thank you so much for your advocacy, and we're so sorry for your loss. Next comment, please.
Good afternoon, Chair Donatia and members of the committee. My name is Anthony Marco, Anthony Markow for the record. My full remarks have also been submitted as a letter of exhibit. SB 138 means meaningful change to NICU babies' access to Medicaid. Many don't know the criteria and do not realize their baby qualifies. SB 138 makes the path to coverage easier. Our baby Bennett was born weighing under a pound. Given our income, we never considered he would be eligible for Medicaid or that we would even need it since we had insurance. Our focus was on his immediate and constantly changing needs. While under this kind of stress and trauma, you can't predict what's next and how much Medicaid could help. Reading the paperwork and learning his low birth weight qualified and based on an SSI disability criteria was far from our minds. We spent our time trying to be with him and to love him. When Bennett needed that emergency flight to UC Davis, we were sure it would be covered. As my wife said, it was not, and the bill was over $70,000 after her insurance. We didn't know how we would pay, but our only focus was on his health and the potential bad outcome. Having Medicaid prior to this would have covered that and a huge stress gone in our lives. At UC Davis, he got Medicaid, and we learned it could be backdated, but despite months of calls and emails, it just never happened. We lost Bennett after just 8 months. The entire time he was hospitalized, even after his death, we fought and stressed to get Medicaid backdated to no avail. That time was so precious. It could have been spent caring for and loving on Bennett. It could have been spent taking care of each other as we grieved. SB 138 will prevent this from being one more trauma families face and prevent that time from being stolen. Please pass SB 138. Thank you.
Good afternoon, Chair Donate and committee members. My name is Robert Haynes, R-O-B-E-R-T-H-A-Y-N-E-S, for the record. My wife Cheryl and I submitted a letter in support of SB 138, and we urge you to support this bill as well. We visited our grandson Bennett in the NICU on several occasions and witnessed the challenging and all-consuming task his parents had managing his care. It was nonstop: machines, doctors, nurses, therapists, crises, decisions, medications, and more. What they did for their son was truly heroic, and the last thing on their minds was exploring insurance policies and procedures. Senate Bill 138 will provide significant support to these NICU families, and we recommend your full consideration of this bill. Thank you.
Thank you so much for your advocacy. And again, we express our condolences to your family. Is there anyone else in Carson City in support of this bill? Please come forward.
Chair, members of the committee, my name is Lindsay Harmon, spelled Lindsey-Harmon, and I am the president of Nevadans for Reproductive Freedom and the executive director for Planned Parenthood Votes Nevada. And we are here to urge you to support SB 138, and I will keep it short and simple.
Good afternoon, Chair, Vice Chair Taylor, and members of the committee. My name is Driana Dimatulak. That's D-I-M-A-T-U-L-A-C, and I'm a legislative extern with Brownstein. On behalf of Neurorestorative, we stand in strong support of SB 138, Bo's bill, and thank Majority Leader Canizaro for her longstanding commitment to Nevada's most vulnerable children. Neurorestorative is a pediatric skilled nursing facility with 3 locations, 2 in Las Vegas and 1 in Reno. Our dedicated and highly trained team provides care to children with complex medical, nursing, and therapy needs, including those with brain and spinal cord injuries. Many of the children that we assist come to us directly after being discharged from the NICU, which is a time filled with heightened anxiety for parents who are already facing overwhelming circumstances. We support this bill because although leaving the NICU is a significant milestone for these children, it also marks the beginning of a challenging recovery period, especially for children who rely on Medicaid. SB 138 is a compassionate and practical measure that will protect the health and well-being of our most vulnerable infants. I urge you to support this bill and to ensure that all NICU infants receive the timely and comprehensive care they deserve while supporting their journey towards recovery. Thank you.
Good afternoon, Chair Donate, Vice Chair Taylor, members of the committee. My name is Jacqueline Nguyen, N-G-U-Y-E-N, and I represent the Nevada State Medical Association, the oldest and largest organization representing physicians in our state. We want to thank Majority Leader Canizaro for bringing this bill and also commend Ms. Atlas and Bo, who presented today. Medicaid coverage is essential for babies in the neonatal intensive care unit. We support this bill because we understand the high cost of medical care, the need for access to specialized care, and the importance of ensuring that everyone, particularly this vulnerable population, has access to equitable health care. As a mother of twin NICU babies myself, and on behalf of our NSMA President, Dr. Joseph Adishak, a high-risk OBGYN, and all of our physician members, we fully support this bill. Thanks.
Good afternoon, Honorable Chair and Committee. For the record, my name is Wendy Colborne, C-O-L-B-O-R-N-E, Chief of Staff for the Building and Construction Trades Council of Northern Nevada. We fight every day for Nevada's working families, many of whom have faced situations like this one, and we are here in solidarity today to support SB 138. Bo's bill isn't just policy. It's an opportunity to nurture our state's future. It's about shielding parents from the crushing weight of catastrophic debt so they can hold their infants close without fear shadowing those first tender moments. As the battle-born state, Nevada knows that every fighter starts small. By investing in the tiniest Nevadans, you're helping to build a future where every child has a fighting chance. This bill helps build a stronger Nevada for working families, one tiny heartbeat at a time. We thank Majority Leader Canizaro for bringing it forward and urge you to support it. Thank you.
Good afternoon, Chairman and Committee. I'm Dr. Terrence McAllister, T-E-R-E-N-C-E, M-C-A-L-L-I-S-T-E-R. I am the president of the Nevada chapter of the American Academy of Pediatrics, as well as a practicing pediatrician in Las Vegas, and I'm here to speak in favor of Bo's bill. When a child is admitted to the NICU, it's never a planned event, it is chaos. And the parents of that child are able to rely on the medical team to make thousands of decisions every day to support that child. They're not asked what the dose of antibiotics should be or what the pressure settings on the vent have to be. They're able to trust the medical professionals, the medical team, to make those decisions. The ability to get Medicaid coverage should be just as simple for the parents. There need to be other specialists that they can trust to make that decision, to guide them in that decision. And it needs to be a simple process because there is so much else on their mind at that moment. And that is why the American Academy of Pediatrics, the Nevada chapter, supports Bo's bill. Thank you.
Reverend Paul Larson, Advocacy Director for Larson, L-A-R-S-O-N, Advocacy Director for Lutheran Engagement and Advocacy in Nevada. I rise to support this bill on behalf of Lutherans across Nevada, that it's important that we take into account medical inequities in our infants.
Good afternoon. My name is Chip Carter, C-H-I-P-C-A-R-T-C-R. I used to know how to spell my name. C-A-R-T-E-R for the record, and I'm representing the Children's Advocacy Alliance of Nevada. CAA is the independent voice for Nevada's children, advancing systemic change in the areas of early childhood, children's health, and child welfare to ensure that every child in Nevada thrives. And I am here to strongly support SB 138, Bo's bill, to provide presumptive Medicaid coverage for newborns who require NICU care. As everyone has said, just like Bo's family and Bennett's family, no family should face the devastating reality of financial ruin simply because their child was born premature and or with medical complications. When a newborn is admitted to the NICU, parents are immediately confronted with overwhelming stress, medical costs, lost income from time off work, and uncertainty about insurance coverage. A single day in the NICU can cost thousands of dollars, and for many families, as we've heard, waiting for Medicaid approval means delayed care, mountains of medical debt, and financial security at an already stressful time. Presumptive Medicare coverage ensures that babies get the care they need immediately without forcing parents into impossible situations. Without Medicare coverage in place from birth, families may face denied claims, delays in care, or forced decisions based on cost rather than medical need. The long-term financial impact of NICU stays can be devastating, particularly for middle-class families who don't qualify for immediate Medicaid but cannot afford the astronomical costs of neonatal care. Even for insured families, NICU bills, as we've heard, often come with high deductibles, out-of-network charges as a surprise, and uncovered services, leaving them tens of thousands of dollars in debt before their child ever gets home. Presumptive Medicare helps ensure every baby gets equal access to care, regardless of their family's financial situation. We know that early medical intervention leads to better long-term outcomes, reducing disability rates, future hospitalizations, and long-term healthcare costs. Ensuring this Medicaid coverage for NICU babies is not only the right thing to do, it is a smart investment in the future in our healthcare system. Therefore, we at CAA urge you to support presumptive Medicaid coverage for NICU babies and ensure that no other family has to choose between their child's health and financial survival. Every newborn deserves the best possible start in life. Thank you very much.
Thank you, Chair and members of the committee. Reagan Comas with R&R Partners here today on behalf of UMC, and I'll be short and sweet and say we are here in support as well. Thank you.
Hi, everyone. Thank you for being here. My name is Alejandra Sataray, ALEJANDRASATARAY for the record. I will also keep it short and simple. I'm a third-year medical student, and I'm currently seeing how important this bill is as I'm going through my clerkship rotations, and I'm fully in support of this bill, and I urge you to do the same as well. Thank you.
Hello, members of the committee. My name is Jorge Monge, last name Monge. I am a fourth-year medical student here at UNR School of Medicine, soon to be graduating, becoming a practicing physician in the community. I am here in support of this bill as well. I have rotated through the NICU and maternity and labor and delivery wards here at Renown, and I've seen firsthand the difficulties that mothers and patients face after birth. And I fully believe that this bill will help to support those families, ensuring that their full attention and care is committed towards the well-being of their children, and ensuring that they do not have to deal with the financial difficulties that often come with giving birth and the challenges that come afterwards. Thank you very much for your time.
Thank you so much. Anyone else in support of this bill? Seeing no one here in Carson City or in Las Vegas, AVH, is there anyone online?
If you'd like to testify in support of SB 138, please press star 9 to take your place in the queue.
Good afternoon, Chair and members of the committee. This is Dora Martinez. I'm representing the Nevada Disability Peer Action Coalition. Thank you to the majority leader for bringing this bill, and we wholeheartedly support it. Just make sure that when they give the written Medicaid application, it's the language that the mom can understand, whether that's English or other. And if the mom has the disability where they're blind, please make sure it's in a electronic format that's fillable so they can do it at their home. And if the mom is ASL user, hopefully there's an interpreter that can help them with that process. Thank you so much. Have a great day.
Hi, committee. My name is Joanne Whitty. That's JoanneWittie for the record. I, too, am a parent of twin NICU babies. And it's difficult to say that I consider myself one of the lucky ones, meaning I am a healthcare professional. I'm a pharmacist by trade. And when I was in the NICU, I had an amazing colleague who highly encouraged me to fill out the paperwork, which when I completed it, it was nearly 2 inches thick. And I, too, thought about setting it aside and not filling it out. She had a social worker come speak with me. We were double covered. We also did not think that we needed to fill out this paperwork. We were like, that's ridiculous. We will never qualify. And when my colleague encouraged the social worker to speak with me, she said, no, you should fill it out. You have 2 babies. Doesn't matter that you're double covered. Your income doesn't matter. You had a baby that was born at 2 pounds, 8 ounces, and another born at 1 pound, 15. And I can tell you that we are ever so grateful that we filled out the paperwork. We didn't receive a single bill from our children's stay. One stayed 6 weeks, and our second baby stayed 109 days. I highly support this bill, and I urge you to do so as well.
Good afternoon, Chair Donate, Vice Chair Taylor, and members of the committee. My name is Rebecca Costa for the record, REBEKA ACOSTA. I am calling today in support of AB 138 as both a pediatric health advocate and the mom of 2 teenagers with lifelong medical conditions, one having spent time in the NICU. I am keenly aware of the financial burden Nevada's families are facing in accessing medical care for their children, and babies born needing care in the NICU are at the most vulnerable. Their families are instantly thrust into life or death decision-making situations. A mother can no longer focus on healing from childbirth, but instead must ensure every opportunity for her child just to survive. The financial cost of NICU stays can easily total hundreds of thousands of dollars, bankrupting even middle and upper middle class families. In Nevada, about 4 in 10 children are covered by insurance other than Medicaid, and our system is forcing many of those families into crushing debt before their baby even has a chance to leave the hospital. As a state, we have a moral and ethical duty to protect our children, ensuring equitable access to appropriate and timely health care. By supporting SB 138, you're providing immediate coverage and financial protection at the most critical time for a newborn and their family. I urge you to act in favor of SB 138 and show our state's commitment to raising healthy and thriving generations now and in the future. Thank you for your time today, and let's pass Bo's bill in honor of Bennett and all of our NICU warriors. Thank you.
Caller with the last 3 digits ending in 000, you may go ahead.
Hello, Chair and members of this committee. My name is Catherine Nielsen. I'm the Executive Director of the Nevada Governor's Council on Developmental Disabilities. And to save you all time this afternoon, we will ditto all of the other comments in support. Thank you so much.
Chair, there are no other callers in support at this time.
Thank you so much. Let's move on to opposition. If there's any opposition, we ask for folks to please come forward, both here in Carson and Las Vegas. And please begin.
Good afternoon. My name is Patrick Kelly with the Nevada Hospital Association. I plan to come here today to support this bill, but at the last minute I received a very extensive conceptual amendment, and I just saw it this afternoon, and I've not had a chance to talk to any of the hospitals except a couple about it. So technically at this point we are in opposition, but I think we can move towards connecting with the sponsor and working things out. But I do want to answer a couple questions that were asked, and one is, we've always been advocates of allowing hospital personnel to do presumptive eligibility, and that has really picked up in the last couple of years. There's now a course that's offered quarterly. It's a 3-day training that we can send people to get them all set up to do this presumptive eligibility. And I did have a chance to talk to a couple of hospitals that had NICU units, and they said they do presumptive eligibility. Now, I did not have a chance to talk to hospitals that did not have a NICU unit, because this covers those hospitals as well. And I just wanted to know where they are in terms of what they're doing and if there are any issues with it. Because as you know, the smaller hospitals tend to have some of the bigger issues with regard to, they don't deliver a lot of babies, they have personnel changes. So I just want to check on all that before we say okay, because I know that if I don't object now, I can't object later. So I'm just trying to preserve that right at this point. Thank you.
Thank you. Any other opposition testimony? Seeing none, AVH, is there anyone online?
If you'd like to testify in opposition to SB 138, please press star 9 now or to take your place in the queue. Chair, the public line is open and working. There are no callers at this time.
Thank you so much. Let's move on to neutral testimony. If there's anyone in neutral here in Carson City or in Las Vegas. AVH, is there anyone online?
If you'd like to testify in neutral for SB 138, please press star 9 to take your place in the queue. The public line is open and working. There are no callers at this time.
Thank you so much. Majority, do you have any closing remarks?
Thank you, Mr. Chair and members of the committee, for allowing us a hearing on Senate Bill 138. I'm Nicole Canizaro, Senate District 6 for the record. Obviously, I have to give a huge thank you to all of the families who came and shared their experiences. In case anybody is not saying it often or enough, I certainly will. It is hard to be pregnant and have a baby. I cannot imagine adding on top of that, watching your baby in the NICU. Those complications, those families should be focused on that, not on whether or not they're going to be able to afford to take their baby home and continue to provide a life for that baby that baby deserves, or in the very heartbreaking cases where that baby does not return home. What I will say about any opposition that we've heard today for this bill, no one has come to talk to me about opposition to this bill. No one has come to talk to me about concerns with the language. If there are concerns, they should find their way to my office. Second of all, what I heard was a lot of this is happening to some extent, making sure that this happens across the board so that there is not a family that is left behind is the very least that we can do and the very least that we can require. There is no reason why, because when you go to a hospital to have a baby, no. If you end up in labor and delivery triage, they're going to ask you a litany of questions. You're going to fill out a litany of paperwork to say all of the things. What is your insurance? How many babies have you had? Were those babies to term? Were there any complications? What are your allergies? What sort of medication are you on? What does your prenatal care look like? What doctors do you see? How often are you seeing them? Have there been any complications as a result of any of those particular appointments? When you have this baby, what do you want to happen when you have this baby? And so on and so on and so on. If we add to that, hey, listen, we want to talk to you about this. Yes, you might have medical insurance. Yes, it might cover some portions of this. Should your baby end up in the NICU, this is what we want you to fill out so that that baby can be covered and you can focus on your baby and not on whether or not you're going to be able to afford this. That is all this bill is about. Hospitals that already provide this sort of care, a birthing hospital, they're covered under Medicaid, right? Let's just make sure people get that presumptive eligibility. It sounds to me like we should, at the next hearing on this bill, which I hope to have, hear a lot more support. I am, of course, available to answer any questions that members of this committee or anybody else may have on this bill, and excited to work through any other details that may be necessary, and hope to earn all of your support for Bo's bill. And thank you again to all of the really brave families, and thank you, Mr. Chair.
Thank you so much for that presentation. We're going to go ahead and close the hearing on Senate Bill 138, and we will now move on to Senate Bill 207. This bill requires the establishment of a program for all-inclusive care for the elderly, and we'll welcome our Vice Chair to begin when she's ready.
Good afternoon. Thank you, Chair Danyante, and to the members of the Senate Committee on Health and Human Services. For the record, I am Senator Angie Taylor, and I proudly represent Senate District 15 in Washoe County. It's a great honor to present Senate Bill 207 today. It requires the establishment of a program for all-inclusive care for the elderly, otherwise known as PACE. This program is a community-based health care program that allows seniors to get medical and social services in their home and in one-stop shop. Presenting with me here this afternoon is Mr. Oscar Delgado, CEO of Community Health Alliance, a very large FQHC in Northern Nevada. He will go over exactly what a PACE program is and how it has impacted the lives of seniors all over the country. Mr. Josh Kurtzik, CEO of Valier, PACE, and Valier Health. He will introduce you to a PACE program in action. You'll get to see what it really is. And then I'm honored to say, sitting next to you to my right is former Governor Bob List. He will share his experiences with the PACE program and why he believes we need PACE in Nevada. For a little background information, this journey for me began when I became the caregiver for my mother. I had no idea how much of a void we have when it comes to caring for our seniors, especially those with additional challenges and especially those with financial barriers, like memory issues, like being low income, the lack of support for day-to-day care, and of course, finances. The PACE program addresses each and every one of those. This bill, by the way, was originally brought back in the 2009 legislative session by Assemblymember Sheila Leslie with the intention to allow seniors more choices and staying out of nursing homes. The original bill placed PACE program within the Aging and Disability Services Division, or ADSD, of the Department of Health and Human Services, DHHS. This bill ultimately shifts the authority responsible for establishing and administering the PACE program from ADSD to any division of DHHS. However, should the bill that establishes a health authority pass this session, this will ultimately transfer to that division and not remain in DHHS. With your permission, Chair, I'd like to just briefly walk the committee through the bill. Briefly. Section 1 of the bill requires that DHHS to establish and carry out a PACE program. The program may be carried out solely by DHHS or the health authority and any division thereof, or in cooperation with another entity, such as state agencies, local governments, the federal government, a federally qualified health center, or a third party. Section 1 also requires the program to comply with federal regulations. After discussions with several stakeholders, the part that required the use of an HQHC is removed with the amendment that was distributed to you today. Section 1 further authorizes DHHS to use personnel from within the department or to contract with any appropriate public or private agency, organization, or institution to provide the services necessary to carry out the provisions of this section. This requires the requirements for a contract entered into with a public or private agency, organization, or institution are also listed in Section 1. Lastly, subsections 5 and 6 of Section 1 require the director to apply for any waiver of federal law to establish the PACE program and authorizes the department to apply for, accept, and expend any federal or private grant of money or assistance to carry out the provisions of establishing the PACE program. There's also a little bit of cleanup. Section 2 and 8 eliminate the authority of ADSD to establish a PACE program, as I mentioned earlier. And sections 2 through 4 remove the references in existing law to such a PACE program, replacing it with Section 1 of this bill. There's the background information, a little walk through the bill, and now I will turn it over to Mr. Oscar Delgado, CEO of Community Health Alliance, and he will do quick introduction of what a PACE program actually is.
Good afternoon, Chair and committee members. It's a pleasure and honor to be here with all of you. It's an honor to be presenting this bill with Oscar Delgado, CEO of Community Health Center, forgive me, OSCAR-DELGADO. Again, thank you. It's an honor to be here in front of all of you, and I will walk through this PACE program and, of course, take any questions as needed. What I have here, as stated already by our Vice Chair and Senator Angie Taylor, the PACE program is a program of an all-inclusive care of the elderly. I'm not going to read word for word. You guys are more than able to do so, but really just hit the high points. It's for 55 and older who otherwise would need a nursing home level of care. There's going to be, and it's a community-based, it's an integrated model, as you'll see here in the next slide, that requires really a focus on patient-centered. What you have here is 11 members of an interdisciplinary team, to sit with the patient and make sure that they have all the care needed from professionals that they would probably otherwise see in the community through transportation or other types of transportation issues, or having a caregiver take them all over town in order to see. This will all take place under one roof, under the care of either an FQHC or another provider that would come in to apply for such services. The PACE model philosophy is really to make sure that we're honoring the wants and needs of the frail elders and their families. As our Vice Chair and Senator Taylor has already expressed, we don't necessarily need a room full of individuals to make the trip here. We all can understand just from within our own families, our own communities, the needs and the stresses on families of reassuring that their loved ones have the care that they need without having to take time off work and to take time away from their families and the stressors involved and such, to have all that surrounding support within a PACE program. Who does PACE serve? Currently across the nation, they are serving over 80,000 older adults receive PACE program daily. What I'd like to share with some of you is, if you could picture in your minds a grocery store. About 2/3 of that grocery store would be an active living space where you would have individuals, nurses, physical therapists, you would have social workers, et cetera, and also individuals that are able to work with each other and making sure that they have socialization. The other 1/3 of that facility would have a clinic, reassuring that those individuals that are currently at a PACE program would have a provider on site, a pharmacy on site, nurse practitioners, they'd have MAs, all the support needed for those individuals to have those needs at that moment. 97% of those individuals that go to a PACE program live within their own homes. The whole idea is that they are not going to a nursing home. It's providing proactive, preventative care, reassuring that those that have chronic issues are meeting all of those needs. 5% of those individuals would be going to nursing home, but they could also be having PACE support. Again, the whole idea is to keep them out of nursing homes, keep them at home, keep them with their loved ones, while also supporting and giving caregiver support. We've talked about kind of the providers that are providing the services in terms of patient-centered support. The services there, again, are meals, primary specialty care, medications, rehab, home care, transportation, and social activities. People ask, how do we get there as required by PACE? And as Josh will be able to express for us a little bit later, is you're required to provide transportation to all of those. And so what you would do is have that provider go pick up Oscar, bring him to the PACE program. They'd spend time there throughout the entire day, where they also receive meals, receive primary care if needed, maybe some general case management support, dressing if needed, some haircuts, etc. And at the end of the day, they would then transport me back to my home, where I would be able to then come back the following day. PACE provides transportation and meals. Again, across the nation, they provide 9 trips per month. Not all PACE individuals go to a PACE center. Some people think that they're just full all the time, only when needed. Some individuals usually only use the clinic. They only go and see the provider. They only receive the pharmacy, and then they go back home if needed. This is only for those that need that additional care. As you can see, this is not new. This would be new to Nevada, of course. But across the nation, there's a growing need. They're seeing the return on investment. They're seeing the care and the return on investment in terms of supporting PACE programs. Just a few years ago, that was down to 84. Now we're going over 180 and growing. It just makes all the sense in the world as similar to an FQHC. We have all these services under one roof. You'll have the same for our elder and frail, and all especially serving the community at large. Unfortunately, as you see, Nevada is not one of those states. What's different on this slide here is now Illinois is now colored in dark blue and is now providing PACE programs. And so it's really a matter of time, and for us, knowing the needs in our community, the growing needs, especially in what I can speak for in Washoe County, is that through your support, as we could start PACE programs as soon as possible. Again, what are some highlights and outcomes? Through all the information data that's been gathered across the nation, it's less than 1 ER visit per year, which is extraordinary, especially for limiting our patients to go on and take those extraordinary costs that we see that are at the ER visits. It's decreased re-hospitalizations. It's also fewer nursing home admissions. Again, I think many can speak to the cost savings and the return on investment for supporting such a program like this one. And Madam Vice Chair, we'll turn back to you.
Thank you. Thank you, Mr. Delgado. Senator Angie Taylor, Senate District 15. Next, I'm going to turn it over to Josh Kurtzig. He's the CEO of Valor PACE and Valor Health, and he is going to talk about what a PACE program actually looks like in action.
Thank you. Thanks, Senator Taylor and Chairman Donate. My name is Josh Kurtzig, Joshua-Kurtzig. I'm the CEO of Valor Health and one of its subsidiaries, Valor PACE. Valor Health, we're based in Oklahoma City. We've been running a PACE this month for 10 years, and we're also expanding to other states later this year and other parts of Oklahoma. We also run a hospice business, we run nursing homes, and so forth and so on. And during that time of 20 years of Valor Health, we realized that nursing homes really are not places people want to be. I think Oscar said it well. PACE's goal is to keep people out of nursing homes, keep them in the community, keep them in their homes, surrounded by their families, with the wraparound services that only PACE organizations provide. And so we can talk about numbers all day. I think the governor in a moment is going to tell you about some of the numbers from Nevada, but I can tell you that from my experience working with PACE, this is the best healthcare program, and I believe it's the future of healthcare in this country. It not only saves money for the states, it provides better care for participants. So what am I talking about specifically? Well, first of all, as Oscar mentioned, people come to the PACE Center when they'd like to increase their social determinants of health. This is an expression that healthcare people throw around. But the idea is when you're among community members, when you're among friends, you do better than if you're sitting at home by yourself. You do better than if you're isolated in a nursing home. They come, they play bingo, they play mahjong, they play canasta? I don't know. They play whatever they play. They get meals, they get healthcare services. We drive them around. We drive them to doctor's appointments. We drive them to their cardiologists, their urologists. We make sure that they have rehab medicine and all of that care. We provide all of their medication. We provide their hospitalizations if it comes to it. We also provide all of their ER visits. We even provide transplants if it comes to it. The risk is on us. That's the best part, is it's in our interest to keep them healthy and out of the hospital. It's in our financial interest to do that. That's good for the state. It's good for the participants. Last quarter, we ran a survey. We asked people in our programs, is your life better off having joined PACE? 92% said yes. We have tremendous satisfaction among our participants and among their families. And I have to tell you that, and I can talk about, if you want, we can talk about cost savings and what Nevada would look like, but to my mind, this is the best thing that's happened to many of our participants. We deal with the most clinically vulnerable, the most food insecure, the most housing insecure populations in our country. The people, the vulnerable people who are both Medicare eligible and Medicaid eligible, low income and elderly, and who need our support. And at Valor and the other 180 PACE programs around the country, we make it our mission. We're mission driven. We're making it our mission to make sure that these people live healthier lives in their homes instead of coming to an institution. I'd just like to say one more thing and just give you one little quick anecdote, if I may. As I mentioned, we're 10 years into PACE. One of our first participants, who is celebrating his 10th anniversary at our program, had a stroke 10 years ago and was paralyzed one side of his body. Actually, Governor, you met this man. He considered taking his own life. And he had made preparations to do so when he joined the PACE program and gave it a month. Since then, we've rehabbed him to walk, to join the community. He's 10 years on. We are able to do that for America's most vulnerable population. We hope that you will consider bringing this to Nevada. I think it would be a great benefit to everyone in this state. Thank you.
Thank you, Mr. Kurzik. And then finally, I call him the cleanup. Governor Bob List is going to talk about his experience with the PACE program and why he believes we need this in the state of Nevada. Governor.
Thank you. Thank you, Senator. I'm Robert List, R-O-B-E-R-T-L-I-S-T. Mr. Chairman, members of the committee, staff, it's a pleasure for me to be here. I remember well the days when I was governor and the folks that I met in the nursing homes whom I often visited, and family members of mine who had been in nursing homes, and how they felt about it and how difficult it was for them, feeling isolated, feeling as if no one loved them, often with no opportunities for recreation or interaction or socialization with others. 5 years ago, I went on a board of directors of a financial institution, and our chairman was a man from Oklahoma City. And as I got to know him, his name is John Giles, I got to know him and found out that his primary business was in healthcare. And he and his 3 partners owned a PACE program in Atlanta, in Oklahoma City. And his family had owned nursing homes all across the Midwest for many, many years. And his story was that he came to the point where he learned how difficult it was for the patients who were there. Nobody wanted to be there. People felt like it was their last stop in their lives oftentimes. And it was very difficult to hire staff. It was an unpleasant place to work. And so he said, we started branching out into a PACE program. And we learned that people loved it. It allowed them to stay in their own homes, often with loved ones, and take advantage of the same benefits that they had, only it was delivered to them by the staff of a PACE operation. They can take them to buy their groceries, they had transportation, they could take them to their doctor's offices, their dentist's offices, they could bring them to the hub or the center where they could socialize and have medical care right there. They can keep their own doctors also. They could take them to the dentist and essentially allow them to continue the socialization with others while still maintaining the family surroundings of their comfortable home. And I said, John, I need to know more about that. We need that in Nevada. And I went back to Oklahoma City and I got introduced to the program there. I met the participants, I met the people that operated it, and I was really moved by how effective it was for these folks. And they told me their stories. And I said, why don't we have that in Nevada? They said, well, we have it in 33 or 34 other states, but why not Nevada? And so I got interested in it, and I came up and I talked to the governor about it. I got to meet with Stacy Weeks, and Stacy said, we need this in Nevada. We need this in Nevada. And I hope that she'll tell you about it today. So in any event, I want to say this, that Nevada has 3.2 million people. We have 811,000 of those. 26% of the residents of Nevada are Medicaid enrolled. 26% of the people in our state are already Medicaid enrolled. 95,000 of those are dual eligible. That is, they're Medicaid and they're also over 65. And the benefits that they can get through PACE are incredible. Medicaid criteria in Nevada is that for adults, it's ages 19 through 64, and their income is less than $20,000. And so we have a lot of people in Nevada that can take advantage of this, that don't even know about it at this point because we don't have it. But one of the things that I like about the program is run by private enterprise. A company like Valor comes in and makes the investment, millions of dollars, to create a facility or a center or a hub or whatever you call it. They put their money at risk to set this up, and then they get reimbursed for the services from Medicaid. And each state has a given formula that is how much, depending upon the local economy and the circumstances financially of the state, they get reimbursed for each patient or each participant. And it's approximately, in Nevada, we've run the numbers. If 2,000 people signed up for this program in Nevada, it would save the state and the federal government $14 million because it's cheaper to operate than a nursing home. And the money that comes back to the PACE program is about $7,000 less per person than the cost of a nursing home. If we had 5,000 of our people enrolled in PACE, it would save us $35 million. And we all know what the difficult costs are with operating government and the amount of taxes and how valuable those tax dollars are to you as members of this committee and to members of the legislature in making appropriations. So I just want to say that Nevada needs this program. It ought to be a bipartisan support. It's good for Nevada, it's good for the patients, it's privately run, and it's good for the federal government. And I'm hopeful that we don't see a cut in Medicaid in Washington. We're being assured that we won't. And I can tell you that Governor Lombardo has been in touch with the White House, urging them not to cut into this money. And I just encourage you all to support it. Thank you, Senator. Thank you, Senator.
Thank you, Governor. Angie Taylor, Senate District 15 for the record. That being said, I'm the only one at this table who has not seen a PACE program. The rest of them have, but they have convinced me that this is something that's really important for our residents here, and hopefully we've convinced you as well. So we stand for questions, Mr. Chairman. Thank you.
Thank you so much. Any questions? Senator Lane.
Hi. So there was a program in Las Vegas that operated, it sounds similar to what this is, and it didn't make it. And so I'm wondering if you're, what was it called? He knows.
I think Senator Lang is referring to that there are Medicare Advantage plans that offer a similar program for a senior daycare, essentially, that weren't successful financially, went financially insolvent. So I think that's what Senator Lang is referring to.
Thank you for your help. And so I'm wondering how this program could be implemented so we can learn from the lessons that happened in Las Vegas so it can continue, because I think it's a really great idea.
Mr. Chairman, through you to the Senator, Angie Taylor, Senate District 15 for the record. I'm not familiar with the program in Vegas, but if it was a Medicare Advantage program, I'm certainly familiar with those. And this is not that. This is more comprehensive care, one-stop shop, picking people up. It's really intentionally, it's the wraparound. That's the best way to put this, to wrap around. And the Medicare Advantage program is a way to get your health care, but they don't do all of the other wraparound pieces that the PACE program does. Governor?
If I may add, Robert List, this program deals with Medicaid primarily. And if an individual is over 65 and also in the Medicare program, they're doubly eligible, one might say. And the reimbursement to the PACE program is slightly more for the people who are over 65. But obviously, it's primarily geared toward the Medicaid, the poor folks that cannot afford it to take care of themselves except to go to a nursing home. They have to be qualified, nursing home qualified Medicaid patients to participate.
Thank you. Any other questions, Senator Son?
Thank you, Senator Taylor. It's always nice seeing you, Governor. I'm very excited about this program, and I just want to understand a little bit more. Originally, it would have been heard through Aging and Disability Service, but now it can be, is it going to be licensed by HHS to, let's say, one of these private providers? And what is the nexus to the federally qualified medical centers? How does that all intertwine?
Thank you, Senator. Angie Taylor, Senate District 15 for the record. Mr. Chairman, through you. An FQHC, as well as an organization, a company like Valor, our agency, which hopefully will be the health authority, right, contracts with them. They're in charge of it, but they contract to a partner, if you will, to put the program together and to run it.
Okay,
Did I answer your question?
I think so. An FQAC can be a PACE
yeah,
center.
absolutely.
Okay, and the bill mandates the use of a federally qualified health center to provide the services. Are there any concerns about the capacity for these centers to meet the needs of the program?
Angie Taylor, for the record. Thank you, Senator. Actually, the amendment took that part out.
Okay.
To leave it open so that certainly it can be an FQHC. It could also be an organization such as Valor. It doesn't require it to be an FQHC. It can be, but it can also be another organization.
Okay, and then if I can follow up some more. you know, Medicaid is not one of the better payers, right? So from our friends that are here that have opened these up in other states, have you examined Medicaid rates here, and is it a profitable model for you? Is it something that we can actively promote and expand? Because I think it'd be a great service for our senior citizens.
Yeah, thanks, Senator. Mr. Chairman, through you, Josh Kersey for the record. The answer is that the Healthcare Authority and Ms. Weeks will have to do an actuarial study before this happens. But generally, I can tell you what the rates are in Oklahoma and other states. For example, in Oklahoma, yes, Medicaid is not a great payer. About 13% of our participants are Medicaid only. Another 87 are dual eligible, meaning also over 65. And so you get a Medicaid payment, and then you get a Medicare supplement on top of it. Medicare paid directly from CMS, the Medicaid portion paid from the state. Obviously, we want the latter. We want the dual eligibles. There also, I should add, there is a risk score adjustment for people who are particularly ill, let's say end-stage renal failure, renal disease. We get a risk adjustment from CMS for that to compensate us for the risk for that. But let's be clear, we are at risk. Our money is at risk. Our capital, in terms of investing $10 or $20 million in building a center, hiring the staff, making sure we have the providers, the trucks, the cars, all that stuff, we are at risk. It's in our interest to keep people healthy. That's how we make our margin. And it's in our interest to expand to as many people as we can. An FHQC, a federally qualified healthcare entity can do that. A private for-profit, a private nonprofit, anyone can do it. I think that's what this bill is about. It has far better outcomes for the participants and for the community than other programs I've seen. And Senator Lang, I think you're talking about, is it a DSNP you're talking about? Because Nevada has 9 DSNPs, I think. I think Ms. Weeks could probably talk about that more. But that certainly is part of the issue, but a part of the solution. But our solution has care coordination that DSNPs don't have. This holistic, this IDT, this interdisciplinary team, it is at the core of what we do. Every day we meet. The IDT meets every single day to discuss every patient and what their needs are to make sure they have what they need. Walkers, medicine, I don't know, diapers, transportation, dentist, vision, everything. We cover absolutely everything. And that's what sets this program apart. Thank you, Senator.
If I could just follow up. Do you believe that we have enough federally qualified health centers to get this program off the ground statewide? I'm concerned about the rural areas, because the rural areas participate in this as well.
Thank you, Senator. Angie Taylor, Senate District 15. Mr. Chairman, through you to Senator Stone, remember, it doesn't have to be an FQHC. It can be. So it could be, just take for an example, it could be the Community Health Alliance in one part of the state. It could be Valor in another part. So one organization wouldn't have to do that. Certainly there's some economies of scale, but it wouldn't have to be an FQHC that has to have the reach all around. Does that answer your question?
I think it does. Okay. And then you mentioned that the HHS would do actuarials, and then it would be a capitated model. Is that the way I'm understanding this? Is how this is?
And again, it would be hopefully the health authority is what we're looking to. The governor wants to make that shift. So.
Right. Okay. Thank you very much.
Sorry, Angie Taylor for the record.
Any other questions? So just for my understanding, I think this was what Senator Lang was mentioning, but this program would allow private industry, both FQHCs, nonprofits, everyone, to be able to establish a PACE program, which essentially you get paid a capitated models to provide primary care, dental services, social work. The senior daycare is the way that you get them in, right? The activities, but the reason why you bring them in is in case if they complain of chest pain or etc., you can monitor them and see them quickly so that you can prevent them from going to catastrophic cases where it becomes more expensive. That's the prevention model. Is that correct?
Yes, Josh Kurtzik for that. Yes, Senator, that's exactly correct. So we provide not only the primary care, but we also cover the hospitalizations. We cover if they do need to end up at a nursing care facility, we cover that. Everything is on us. We use the daycare center to keep them socially engaged. We provide meals. Of course, transportation has been mentioned several times. But we also make sure that we are monitoring their social, physical, nutritional, health, the wraparound services to keep them healthy. Yes, sir.
Thank you. The only thing, this is just a recommendation, more so with the implementation of the bill, not really the language. One of the critical aspects of making sure such program is effective is making sure that adequate transportation is being provided to the participants of it. And so I want to make sure that if there's an agreement to receive a capitated payment, that you're upholding the services that you're promised to deliver on. So for example, right, what we saw with Medicare Advantage plans was they offered it as a service, right? So if you enroll in our Medicare Advantage plan, the provider would receive the capitated payment. They would offer these senior daycare centers or facilities who provided them social work, etc. But the transportation was always a headache because we didn't have, or what we saw in Las Vegas was that the fleets were not afforded to seniors to be they weren't the vans or the transportation that they were equipped did not have the ability to transport folks that have disabilities. And so if you're going to agree to get the capitated payment, there should be some level of security that you're actually delivering on that and that you're not avoiding picking people up and shifting them to the insurance carriers simply because you just don't have the means to do so. So that's more of an implementation thing. That's not really a more so on the policy lens. But I just want to make sure that we're clear that there are requirements that are going to have to come forth with you being on the hook for the contract, right? It's not just a free-for-all and you doing bingo with patients, right?
Yeah, if I may, Senator Josh Kurtzig, yes, I completely agree. We are subject to state audits constantly, CMS audits constantly to ensure that we provide the very services that you're mentioning. We have something called an SAA, which is a state authorization agreement, basically a tri-party agreement between the provider, us, or or anybody else, the state and CMS, where we contractually agree to all of the services that you just mentioned, including, for instance, vans that can take wheelchair-bound people, non-ambulatory people, and so forth. Could I just, if Mr. Chairman, you don't mind, answer the Senator's question about rural areas? Obviously, this is a rural state. Oklahoma is too, with just a few population centers. One of the things we pride ourselves on is being able to deal with rural populations through telehealth and other sort of workarounds to make sure that these, and providing transport when they do need to be in the center, but also contracting with local providers, local hospitals in these towns and communities to make sure that they don't have to drive into Reno, drive into Las Vegas for services. They can drive, we still pay for it, and more importantly, we coordinate it to make sure that we track their health throughout the whole entire process. But we try to keep them, again, in the home and as close to the home as possible. We also work in some cases with local senior centers and other communities that are already established to be the daycare centers there. Senator, Mr. Chairman, a lot of the rules that you're talking about will come in the rules setting part of how we set the rules for this in Nevada. But yes, I agree. That's an important consideration. Thank you.
Thank you. And again, just the reason why I mentioned this was because I was a part of the program that did it for Medicare Advantage, and so I saw the downfalls of the complaints that many patients are going to give you, right? And so in terms of making sure that the services are just and that people actually get the care that they need, we have to take that into consideration as we're doing the rulemaking process. So it's not really a no, we shouldn't do this. It's a yes, 100% we should do this, but we want to make sure that if we're going to do this, then you're going to do the services that you're entrusted to do and deliver on. So just want to make sure that we're on the same page for that. Okay. Senator Tice, did you have one question?
Thank you, Chair, and I apologize for being late to this party here. I was presenting a bill, so, but certainly understand the program. I appreciate the questions about the rural area. One of the things that you mentioned just now, sir, was the telehealth component of this. Out in the rural areas, frequently we don't have good internet service. Your patients may not even have a computer. So how will that be part of the setup and part of the overall coverage for that access?
Thank you, Senator. Do I have to say my name every time?
Yes, you do.
Okay. First time, sorry.
I was going to say, I say mine every time. So.
Josh Kurtzig, thanks, Senator. The answer to your question is I don't know. I'm happy to tell you when I know and happy to tell you when I don't. I don't know. We haven't really, telehealth, we don't really need a Zoom or a screen, a telephone call is okay. In some cases, I assume most people will have access to that kind of technology. So I don't know. I can tell you what we do in Oklahoma is we do a combination of regular visits and telephone calls and Zoom, FaceTime type things. I don't know how it would work here, to be honest.
Well, thank you, Mr. Chair. So thank you for that, because out in rural Nevada, my cell phone doesn't work most of the time. And so if you're looking at going out to rural Nevada to see some of my patients, literally, when I go out, I was just testifying on at natural resources about a hunting thing. Literally, I have Starlink, and I take my satellite with me so I can have. People think I'm crazy. I would want to be off the grid, right? But I have that satellite with me so that I can have cell service, so that I can have emergency whatever and contacts. And so it's just not available. So I just would want to make sure that that would be part of the coverage, to say, oh yeah, we'll cover everybody with telehealth. It's not, it's a lot easier said than the reality of that. And getting on to, and a lot of my rural folks aren't going to use the cell phone because it's just not available. And so just understanding what that concept is. I just want to make sure the coverage, people promise rural health all the time, and then the deliverables are different. And so I want to make sure that indeed that understanding, and I appreciate you saying you just don't know, because that's the best answer when you don't know, right? And so it's a unique bird out here with our mountains. Oklahoma's a different set, the mountains aren't quite the same, and the cell just doesn't get through. So it just would caution you about making sure that accessibility, and then per our chair's comment regarding transfers and making sure that there's ride services, and that's a big issue, getting a patient. I would always see whatever patient walks through my door, but getting them to that specialist in another area is a huge concern. So making sure that transfer is included, and not only yes it's included, but if there's nobody that does that there, I mean that's also a concern. You promise the moon, but then there isn't any, satellites. There isn't any lunar landings, and so I really have concern about that.
If I may add briefly, Senator Robert List, I too have family in rural Nevada, and I know exactly what you're talking about when you talk about those challenges. We've had that discussion with Stacy and with her staff. I know that that's a big concern on her part. We were asked about it. Valor does have a territory that includes, that they're expanding into, including Native American communities in Oklahoma, and so they're having some new experiences with that. I think it's fair for me to say, to represent to you, that Valor, or probably any other provider that you would deal with as a state, will, I think, try to be creative and work for ways, and the law of PACE allows a lot of flexibility and to be creative and work out ways to reach rural Nevada. I certainly want to see that, and I know they do too.
Can I ask just one more question, more logistically? If there was I understand there's going to be a procurement process probably that we can amend into the bill and talk more specifics on that, but in the other states that you have seen this, is there like a minimum standard of what types of services are offered in the PACE program? So, for example, if we wanted to say every facility that is open under the PACE program, in exchange for you getting a capitated payment, you have to offer like primary care, behavioral health care, dental, and say diabetes and cardiovascular health, right? Those are the top issues that we know that seniors suffer from, and every center has to have that as a base minimum. Have other states considered that as part of opening these centers? I know there's a differentiation of whether or not you want to have physical therapy, wellness, et cetera, but is there at least a standard of what you have to offer?
Sorry, actually, Josh Kurtzig. Actually, Senator, there is a body of at least 17 services that by federal law we must provide, including everything that you mentioned. I think actually someone from the NPA, National PACE Association online, they could probably answer the details. But as we go through the process, you'll see that we provide more than the 17 minimum requirements. Everything you've mentioned, diabetes care, primary care, therapy, everything else, there's no choice. We must do that as part of our contract.
I don't think we need to go into detail, but if you can just send me the follow-up for it, I just personally would like to read more into it.
Sure.
So, yeah.
Chair, to answer Oscar Delgado, CEO, Community Health Alliance. The slide that we have here was provided to us by the National PACE Association. as required, like an FQHC, we're required by the feds, as Josh pointed out, to provide X services in order to be to cover our patients. So to answer your question, we'll get you an updated one, but this is the one that was provided to us as of last week that's required. Every state may add probably additional services, but transportation is part of one of those as part of this whole entire algorithm in terms of what that capitated rate looks like. Again, similar to an FQHC, very heavily audited, regulated by the feds, and reassuring that in support of providing patient-centered care, that you have to provide all these under one roof, and if the patients don't receive that under that roof, that is provided to them one way or another. That's covered by the entity that's providing the PACE program.
Great, thank you so much. I think that concludes our questions. Let's go to support testimony. So if you would like to support this bill, we ask for folks to please come up either in Carson City or in Las Vegas. As we rotate folks, and you may begin when you're ready.
Good afternoon, Chair Donate and members of the committee. I am Nancy Bowen, CEO of the Nevada Primary Care Association, NANCY-BOWEN. We represent the state's community health centers, otherwise known as federally qualified health centers, which provide comprehensive primary dental behavioral health care to over 116,000 Nevadans. Our members have been interested in participating in the PACE program for about the last 8 years. Although the conceptual amendment expands eligibility for participating in the program, we are grateful to the Senators Taylor, Donate, and Neal for recognizing the value of health centers in delivering these services. We are in strong support of SB 207.
Chair Donate, Vice Chair Taylor, distinguished members of the committee, thank you for the opportunity to testify today. My name is Kelsey Avery, K-E-L-S-E-Y-A-V-E-R-Y, for the record, and I'm the Director of State Government Affairs for SCAN Group. I'm privileged to testify today in support of Senate Bill 207, which of course requires the establishment of a PACE program in Nevada. To tell you a little bit about SCAN Group, we are a leading not-for-profit healthcare organization dedicated to keeping seniors healthy and independent. SCAN, which is short for Senior Care Action Network, was founded nearly 50 years ago by a group of fiercely independent seniors who knew there had to be a better way to get the medical and social services they needed to live safely at home as they got older. Today, SCAN serves over 300,000 individuals through Medicare Advantage, and we are proud to be a growing plan option for Nevada seniors since 2021. Our dedication to our mission of keeping seniors healthy and independent led SCAN to co-launch My Place Health, which provides comprehensive, personalized care through the PACE model. Today, My Place Health offers health coverage and services at no or low cost to PACE-eligible seniors within the Los Angeles service area. Under the PACE model, My Place provides and coordinates the entire continuum of healthcare and supportive services for which a participant is eligible under both Medicaid and Medicare, from preventive care to hospitalizations to long-term care to nutritious meals and social activities. My Place Health's high-functioning interdisciplinary teams of physicians and other healthcare professionals develop customized care plans that reflect each PACE participant's life goals so the care they receive is customized to their individual preferences. You've already heard a fair bit about the PACE model during this hearing today, so I will not repeat what other presenters have already shared. I will simply reiterate that PACE promotes independence and the highest levels of functioning for vulnerable older adults while allowing choice and dignity for both enrollees and their families. And I'll also emphasize that PACE has earned wide recognition as a top-performing and cost-saving model for seniors with complex health and social needs. For example, one study found that PACE enrollees cost the state's Medicaid program about 40% less than the average amount that would have been paid for a similar Medicaid member who was not enrolled in PACE. As a mission-driven organization dedicated to keeping seniors healthy and independent, SCAN Group strongly supports the PACE model and SB 207. We extend our sincere appreciation to Senator Taylor for her enthusiastic support for bringing this model to Nevada, and we look forward to Nevada joining 33 states and the District of Columbia in making this highly effective program available to older adults in our communities. We urge the committee to vote yes on SB 207. Thank you.
Hello, Senator Donate and members of the committee. I'm Jacqueline Nguyen, Nguyen, with the Nevada State Medical Association. We'd like to thank Senator Taylor for presenting this bill. I'll keep it short and sweet. We are supportive of comprehensive care and know that many times wraparound services are critical to successful care, especially preventative care. Therefore, we're supportive of SB 207. Thank you.
Thank you so much. Anyone else here in Carson City? Seeing none here or in Las Vegas AVH, is there anyone online in support?
If you'd like to testify in support of SB 207, please press *9 to take your place in the queue. Caller with the last three numbers ending in 097, you may begin.
Thank you and good evening. Thank you for the opportunity to speak with you about PACE today. My name is Peter Fitzgerald, Fitzgerald, and I am the Executive Vice President for Policy and Strategy at the National PACE Association. I'm very pleased to be with you and speak in support of SB 207. Given that individuals age 65 and older are the largest age group in Nevada, NPA has long supported and advocated for PACE in Nevada. PACE is a program, as you have already heard, that helps older adults who need long-term care live at home with a higher quality of life and at a lower cost. Through PACE, older adults continue living in their own home rather than in a nursing home. The comprehensive and integrated services of PACE simplify access to needed care. Older adults in PACE have better health outcomes and a higher quality of life, and PACE lowers the cost of care for individuals, families, and taxpayers. As you already heard a great deal about the program from the excellent speakers previously, I'm just going to touch on a few points to emphasize them. It's notable that PACE programs are serving a population that is entirely at a nursing home level of care, and yet 95% of the people in our care are able to continue living at home. And within that percent, 50% of the people that we're taking care of have Alzheimer's. The PACE is a program that has proven its success, really helping some of the most difficult to care for, most vulnerable individuals live at home, and offering their family caregivers the support they need so that they can remain a part of their loved ones' lives while also carrying on with their own lives. There's been some discussion about PACE in rural areas. We have a significant number of PACE organizations operating in rural areas across the country, and they've been extremely successful there. We actually see in rural areas a higher uptake of the PACE program as a percentage of the population in that community that need care than we see in urban areas. And I think that largely reflects the fact that many rural areas lack access to care, and that problem is only getting worse as we see some of the financial strains that are leading many rural long-term care facilities to close. I would bring to the attention of the committee a recent report by the National Advisory Commission on Rural Health and Human Services that highlighted PACE as a solution for offering better care to older adults living in rural areas. You can find that report on the DHHS website, and the study that underlied it was led by former Governor Jeff Collier of the state of Kansas. Underscoring support of the federal government for PACE in rural areas, the Health Resources and Services Administration's Office of Rural Health Policy recently issued an opportunity for funding notice to support the development of PACE in rural areas. And that opportunity is currently live with a due date of April 17th. So we are seeing a lot of success in rural areas. I did want to also stress the integrated care nature of PACE. Unlike some of the other programs that we have heard about, Medicare Advantage, special needs plans, PACE is actually a provider, not only a health plan. So PACE organizations have learned to integrate the care of the people that are in their care, along with the responsibilities of receiving a cap and operating as a very small, specialized health plan for a very challenging population. So given that PACE helps older adults remain at home
Sir,
and provide outcomes,
if you can please complete your
quality of
remarks.
life. Yep. Given that with the higher outcomes and saving dollars, MPA urges the legislature to move forward with this bill and bring PACE to Nevada. Thank you.
Hello, my name is Marie Baxter, Marie Baxter, and I am the CEO of Catholic Charities and of Northern Nevada. And as one of the largest providers, not only in the metropolitan Reno Sparks area, but in rural Nevada and also working with our tribal communities, I just wanted to offer my support for Senate Bill 207. There is so much need for seniors and vulnerable populations that we see on a daily basis, and PACE programming would make a tremendous difference to Nevada's needs. Thank you very much.
Barry Johnson, Las Vegas. We need real in-home psychiatric care for dementia patients, not more social workers. We need hospitals that are held accountable when they abandon patients. We need a Department of Aging that protects families, not tears them apart. Your actions to lower pay for doctors and use residents, students instead, destroyed many families' lives. We have lost almost everything taking care of my mom. My 89-year-old dad almost died helping her because I had to work. Dementia patients are in danger because government cuts doctor pay. Metro has no way of helping families get elderly parents to the hospital when they need help. When my mother stopped taking her dementia medication because it made her urinate more, Metro had to help us convince her to go to Southern Hills, saying that we were all going with her, but had no legal way to force her to go. And what did we find at Southern Hills? A horrible psychiatric attending who left on vacation, leaving a student doctor illegally in charge, who then went out to party for the weekend. My mom was left brought in a hospital bed, dementia spiraling out of control. We brought her home, she was worse. We begged the Department of Aging for help. When we had affidavits to multiple doctors saying she needs psychiatric, not social workers, what did they do? Social workers told my mother we're trying to put her in a home. That reckless statement turned her against us, made her become convinced that we were her enemies. Instead of the Department of Aging helping us, they started a protective order against my dad and I, which is laughable. And an angry, vindictive dementia patient off her medications. If we had not tracked down the social worker and went to the Department of Aging office for intervention, they might have taken my mother away from us entirely. The family court failed to understand the reality of dementia, attempting to send attorneys and social workers instead of medical professionals who could actually help, which we had to stop to keep her from thinking we were trying to put her in a home. And now the most painful part, my mother died on February 18th, almost a month ago, due to Dr. Astor and Spring Valley doctors. And just 3 hours ago, Spring Valley contacted me to set up institutional Medicaid weeks after her death and 2 extra weeks before we tried to make that happen. To make matters worse, the undereducated doctors at Spring Valley still haven't signed her death certificate, leaving the official cause of death unknown, so she's still sitting at the funeral home. This is not just scary, it's a disgrace. Her good doctors left because you lowered their pay. Representative Susie Lee wants more resident doctors to help her stock portfolio instead of restoring doctor pay rates so we have good doctors. For years, we have been told that our system will protect the elderly, the hospitals, state agencies, and the courts to support families in crisis. But what I experienced, the failures and indifference and incompetence, is proof that Nevada's medical system is just not failing the elders. It's actively
If you can
harming
please
them.
finish your remarks.
Instead of getting care, we got bureaucratic red tape. Instead of doctors, we got social workers unqualified to handle dementia. Instead of compassion, we got legal threats against the very people we're trying to help. It's not my tragedy, it's a warning. If this system is not held accountable, this will happen to countless other families.
Thank you so much for your comment, and we're sorry for your loss. AVH, is there anyone else?
The public line is open and working. There are no callers at this time.
Thank you. Is there anyone in opposition for the bill? Seeing none here or in Las Vegas, AVH, is there anyone in opposition to the bill?
If you'd like to testify in opposition to SB 207, please press *9 to take your place in the queue. Chair, the line is open. There are no callers at this time.
Thank you so much. Anyone wishing to testify in neutral on the bill, please come forward. AVH, is there anyone online?
Public line is open and working. There are no callers at this time.
Thank you. Senator Taylor was very excited to pass the bill. Any closing remarks, ma'am?
Thank you, Chair. Angie Taylor, for the record. I just want to say that because of the work of Assemblywoman Sheila Leslie in 2009, the state can have a PACE program. This is going beyond saying we can have one. It is saying we will have one. And today we have more seniors in need of this program than we did back in 2009. So I urge you to vote to support Senate Bill 207. Thank you so much.
Thank you so much. With that, we'll go ahead and close the hearing on this bill, and we will now move to the last agenda item, which is public comment. So if there's anyone that would like to provide public comment, we ask for folks to please come forward. Seeing none here in Las Vegas, AVH, is there anyone online?
Public line is open and working. There are no callers at this time.
Thank you so much. Members, are there any comments before we adjourn? Seeing none, thank you so much for everyone for joining. That concludes the order of today, and our next meeting will be on Thursday, March 13th at 3:30 p.m. And it will be our picture day. Thank you so much. Meeting's adjourned.